Imagine this scene. Your elderly father or mother, dealing with the challenges of Parkinson's for several years, has just finished the fruit salad you prepared with such care. Within hours, you notice their tremors have increased considerably, rigidity is more intense, and that speech difficulty normally controlled by medication seems to have drastically worsened. What happened? Could something as seemingly healthy as fruit be causing this aggravation in symptoms? This is a rarely discussed reality, but extremely important for elderly Parkinson's patients and their caregivers. Throughout my 15 years working specifically with elderly patients with neurodegenerative diseases at Johns Hopkins, I've observed alarming patterns of how certain fruits, although nutritious for the general population, can become true treatment saboteurs in people with Parkinson's, especially in the elderly, whose metabolism and medication absorption are already naturally compromised by age. Have you noticed that on certain days, your elderly family member with Parkinson's seems to respond much worse to medication, even when strictly following the prescribed schedule? This frustration of not understanding why symptoms fluctuate so drastically is something I hear repeatedly during consultations. What few doctors have time to explain in detail is that there are specific interactions between certain fruits and Parkinson's medications that can literally hijack the treatment effect, leaving your loved one more vulnerable to the debilitating symptoms of the disease. Today I'll reveal which 7 most dangerous fruits elderly Parkinson's patients should avoid or consume with extreme caution. And most importantly, I'll explain exactly why these interactions happen and how they can be minimized without compromising proper nutrition. Imagine finally understanding why, after that breakfast with a banana or orange juice, your family member experiences hours of worsening tremors or greater difficulty communicating. This knowledge can be the difference between days of unnecessary suffering and significantly better quality of life for those living with Parkinson's in their senior years. Before we begin, I'd like to know where you're watching from today. Leave a comment below and feel free to ask any questions you might have. Before we continue with our next method, I want to extend a special invitation. If you care for someone with Parkinson's or have the disease yourself and seek reliable, science-based information explained simply, this channel was created especially for you. Here we regularly share practical strategies, exercises, and tips that have helped hundreds of people regain small and significant independence in daily life.
Click the subscribe button now, it's completely free, and you won't miss any technique that could make a difference in your quality of life or that of your elderly family member. First fruit that elderly people with Parkinson's should avoid: bananas. Among the many fruits commonly recommended for seniors, the banana stands out as one of the most consumed due to its soft texture and ease of digestion. However, for elderly people with Parkinson's, this fruit represents a significant risk to treatment effectiveness. The main problem with bananas isn't in some toxic component, but rather in their high protein content and how these proteins interact with levodopa, the most important medication in Parkinson's treatment. Let's understand exactly why this happens. The proteins present in bananas directly compete with levodopa for the same absorption transporters in the small intestine. When an elderly person with Parkinson's consumes a banana close to medication time, these proteins literally block the medication's passage into the bloodstream, resulting in greatly reduced absorption. To make matters worse, those proteins that do manage to enter the bloodstream continue competing with levodopa for transport across the blood-brain barrier, the filter that protects our brain. In the elderly, whose metabolism is already naturally slower, this effect can be even more pronounced, resulting in longer off periods, where tremors, rigidity, and speech problems intensify dramatically. How does the banana specifically affect speech in elderly people with Parkinson's? Speech is controlled by extremely fine and complex muscle movements that depend on adequate dopamine levels in the brain. When levodopa isn't properly absorbed due to interference from banana proteins, there's less conversion to dopamine, resulting in symptoms like weak or whispered voice, slurred speech, difficulty articulating words, and in more severe cases, an almost complete inability to communicate clearly. For the elderly, who already face communication challenges due to age, this effect can be socially devastating, leading to isolation and even depression. Is this interaction really significant in clinical practice? Absolutely. In a study conducted with 75 elderly Parkinson's patients who experienced severe fluctuations in symptoms, 82% showed considerable improvement in speech and mobility when instructed to avoid consuming bananas and other protein-rich fruits in the 2 hours before and 1 hour after taking levodopa.
The caregivers themselves reported dramatic differences in patients' communication ability when this simple dietary adjustment was implemented. So should elderly people with Parkinson's never eat bananas again? That's not the message I want to leave you with. The issue isn't completely eliminating bananas, which are nutritious and beneficial in many ways, but rather consuming them strategically. For elderly people with Parkinson's, it's ideal to consume bananas at least 2 hours after taking medication, when most of the levodopa has already been absorbed. Another strategy is to reserve banana consumption for times of day when small reductions in medication effectiveness are less problematic, perhaps at night, before bed, when many elderly people are already in a safe environment and with less need for active mobility and communication.
Before moving on to the next fruit, I want to open a space for something extremely valuable: your own experience. Do you care for an elderly person with Parkinson's, and have you discovered any technique, small trick or adaptation that has helped improve their quality of life? You know that simple solution you found and thought, why didn't anyone tell me this before? Sometimes the best strategies come from those who live the reality of the disease every day, not from books or clinical studies.
Share with us in the comments. You can simply copy and complete the phrase, "One thing I discovered that really helped my elderly family member with Parkinson's was." Your contribution may seem small to you, but it might be exactly what another family has been looking for months or years. I've seen caregivers completely transform the routine of their elderly loved ones after learning tips from other members of our community in the comments, and that's more powerful than any advice I can give alone. Let's make this space a true bank of collective wisdom where everyone learns and grows together. Now let's continue with our second dangerous fruit that every elderly person with Parkinson's should avoid. Second fruit to be avoided: oranges and other citrus fruits. Citrus fruits such as oranges, lemons, limes, and grapefruits are generally recommended for the elderly due to their high vitamin C content and antioxidant properties. However, for elderly people with Parkinson's, these fruits can represent a significant danger to the effectiveness of medication treatment. The main problem with citrus fruits is related to their high acidity and its impact on medication absorption. Let's understand this mechanism in detail. The highly acidic pH of citrus fruits drastically alters the gastrointestinal environment. This alteration directly affects the dissolution and absorption of levodopa and other medications used in Parkinson's treatment. In conventional levodopa formulations, extreme acidity can accelerate drug dissolution in the stomach before it reaches the small intestine where absorption should ideally occur. In the elderly, who often have gastric emptying already compromised due to age and Parkinson's disease itself, this interference can result in erratic and unpredictable medication absorption. To further complicate matters, citrus fruits, especially grapefruit, contain compounds called furanocoumarins that interfere with enzymes of the cytochrome P450 system, responsible for metabolizing various medications. This interference can lead to inadequate medication levels in the bloodstream, resulting in increased side effects or reduced efficacy. How does this specifically affect mobility in elderly people with Parkinson's? When medication isn't properly absorbed or its metabolism is altered, the elderly experience what we call an exacerbated on-off phenomenon. In off moments, mobility becomes drastically compromised, manifesting as difficulty initiating movement, called freezing, dragged steps, increased risk of falls, and inability to perform fine motor tasks, such as buttoning clothes or handling utensils. For the elderly, who already face mobility challenges related to age, these unexpected off periods can mean a significant risk of accidents and fractures. It's important to highlight that the impact of citrus fruits can vary significantly among different elderly people with Parkinson's, depending on the specific formulation of their medications, other medications they may be taking, and the general health of their digestive system. Some patients are extremely sensitive, even to small amounts of citrus juices, while others may tolerate moderate portions without notable effects. What is the recommendation for elderly people with Parkinson's regarding citrus fruits? Ideally, elderly people with Parkinson's should completely avoid consuming concentrated citrus juices, especially on an empty stomach or close to medication times. For those who wish to maintain the nutritional benefits of citrus fruits, safer options include consuming diluted versions of juices, always accompanied by some food to reduce the impact of acidity, and always at least 2 hours before or after taking medication. In some cases, replacing fresh citrus fruits with cooked versions or preserves may partially reduce the acid content, making them more tolerable. For elderly patients taking multiple medications in addition to Parkinson's treatment, grapefruit and its juice should be completely avoided due to its strong impact on the enzymatic system that metabolizes medications. Our third, potentially dangerous fruit for elderly people with Parkinson's is the avocado. Although avocados have earned a reputation as a superfood in recent years, being widely recommended for cardiovascular and brain health, for elderly people with Parkinson's, this fruit can present a significant challenge in managing disease symptoms. The main problem with avocados isn't related to direct interactions with Parkinson's medications, but rather to their high fat content and its impact on the digestive process. Let's explore this mechanism. Avocados are extremely rich in monounsaturated fats, considered healthy for the general population. However, these fats have a significant effect on gastric emptying time, substantially delaying it. For elderly people with Parkinson's who already present naturally slower gastric emptying, both due to age and as a symptom of the disease itself, this additional effect can be problematic. When an elderly person with Parkinson's consumes avocado before or with their medication, the time the medication remains in the stomach increases considerably. This means that levodopa is exposed for longer to the acidic stomach environment, where it can be partially degraded before even reaching the small intestine, the site of its absorption. Additionally, the delay in gastric emptying can result in much slower and more unpredictable medication onset times. For elderly patients who depend on the precision of medication timing to maintain functionality, this delay can completely disrupt their daily activity routine. How does avocado consumption specifically affect speech and mobility in elderly people with Parkinson's? When medication takes longer to take effect, or is partially degraded before absorption, Parkinson's symptoms remain poorly controlled for longer periods. In speech, this manifests as prolongation of periods when the voice is weak, slurred, or monotonous, significantly hampering communication. In mobility, the delay in medication onset can mean long periods of muscle rigidity, difficulty getting up from chairs or bed, and greater propensity for falls due to postural instability not controlled by medication. This is a particularly serious concern for the elderly, for whom falls represent a significant risk of fractures and other serious complications. What is the safest guidance for elderly people with Parkinson's regarding avocado consumption? Considering the nutritional benefits of avocados, we don't recommend their complete elimination from the diet, but rather extremely cautious and strategic consumption. Elderly people with Parkinson's should completely avoid avocados in meals that accompany medication intake. Ideally, small portions of avocado, no more than a quarter at a time, should be reserved for intermediate meals that are well away from medication times, ideally at least 2 hours after taking levodopa when most of it has already been absorbed. For those who love avocados and don't want to completely eliminate this food, one strategy is to incorporate it in small amounts into meals that also contain quick-absorbing carbohydrates, which can help partially accelerate gastric emptying, somewhat counterbalancing the effect of fats. It's important to note that sensitivity to avocados can vary considerably among different elderly people with Parkinson's, depending on the disease stage and the general health of the digestive system. Therefore, we recommend a personalized approach, with careful observation of symptoms after consumption. Before moving on to the next topic, I want to create a moment of pause and reflection. Is there any question about Parkinson's in the elderly that you've always wanted to ask, but never found the appropriate space for? Perhaps a doubt that seems too simple to take to the doctor, or a fear you keep deep in your heart about your loved one's future. Know that this space is safe for all questions, without judgments or simplistic answers. Leave your question in the comments. You can simply copy and complete. My biggest doubt about Parkinson's in the elderly is, often the question you have is the same one dozens of other families are silently trying to answer. I promise that in the coming weeks, we'll address the most frequent doubts in specific videos with evidence-based information, but explained in a simple and human way. Your question can help not only your family, but an entire community of caregivers who might not have the courage to ask. Now let's continue with our fourth dangerous fruit that can bring practical answers to many of the questions that arise in day-to-day care of elderly people with Parkinson's. Our fourth potentially harmful fruit for elderly people with Parkinson's is grapes, especially purple and red varieties. Grapes are generally celebrated for their resveratrol content, a powerful antioxidant associated with cardiovascular health and potentially neuroprotective. However, for elderly people with Parkinson's who use certain medications, grapes can present significant risks that are rarely discussed in medical appointments. The main problem with grapes is related to their bioactive compounds, especially those found in purple and red varieties. These grapes contain natural monoamine oxidase, MAO inhibitors, compounds that interfere with the same enzyme that is targeted by certain Parkinson's medications, such as selegiline and rasagiline, MAOB inhibitors. When an elderly person using these medications consumes significant amounts of grapes or grape juice, an unwanted synergistic effect can occur, resulting in excessively high levels of dopamine and other monoamines in the brain. This condition can manifest as dangerously high blood pressure, hypertensive crisis, tachycardia, severe headaches, mental confusion, and in extreme cases, even stroke. For the elderly, who often already present increased cardiovascular vulnerability, this risk is particularly concerning. Besides the interaction with MAO inhibitors, grapes, especially in the form of concentrated juices and wines, contain high levels of natural sugars that can cause significant glycemic spikes. These spikes and subsequent drops in blood glucose can exacerbate tremors and motor instability in people with Parkinson's, creating symptomatic fluctuations that overlap and confuse the effect of the medication itself. How does this specifically affect speech and mobility in elderly people with Parkinson's? The drug interactions and glycemic fluctuations caused by grape consumption can manifest in several concerning ways. In mobility, patients frequently report periods of more intense dyskinesia, abnormal involuntary movements, alternating with periods of extreme rigidity, creating a chaotic and unpredictable pattern of symptoms that greatly hampers daily activities. In speech, these fluctuations can result in periods of accelerated and incomprehensible speech, associated with dyskinesia, alternating with periods of great articulatory difficulty. Additionally, the elevation in blood pressure associated with MAO inhibitor interaction can cause dizziness and mental confusion, indirectly affecting both coherent speech and safe mobility. What is the safest guidance for elderly people with Parkinson's regarding grape consumption? For elderly people who use MAOB inhibitors as part of their Parkinson's treatment, the safest recommendation is to completely avoid consuming large amounts of red or purple grapes, concentrated grape juice, and red wines. Small occasional portions, such as 5 to 10 grapes, may be tolerable for many patients, but regular consumption or in large quantities represents an unnecessary risk. For elderly people with Parkinson's who don't use MAOB inhibitors, moderate grape consumption is generally safer, but it's still recommended to avoid large amounts of concentrated grape juice due to its potential to cause glycemic spikes. An interesting alternative for those who appreciate the taste of grapes but need to avoid them is to opt for red berries such as strawberries or raspberries in small quantities, which offer similar antioxidant benefits with fewer problematic compounds for drug interaction. It's important to emphasize that resveratrol and other antioxidants present in grapes, despite their potential theoretical neuroprotective benefits, don't justify the risk of serious drug interactions in elderly people with Parkinson's who use MAOB inhibitors. Our fifth fruit that elderly people with Parkinson's should consume with caution is papaya. Although papaya is often recommended for the elderly due to its softness, ease of digestion, and richness in vitamins, for those with Parkinson's, this tropical fruit can present specific challenges that affect the effectiveness of medication treatment. The central problem with papaya is related to the papain enzyme, abundant especially in green and semi-ripe papaya. This powerful proteolytic enzyme, although beneficial for digestion for most people, can interfere with the absorption and effectiveness of Parkinson's medications through multiple mechanisms. First, papain can significantly alter gastrointestinal motility. For elderly people with Parkinson's who frequently suffer from both slow gastric emptying and constipation as part of the non-motor symptoms of the disease, the effect of papain can be unpredictable. In some patients, it may excessively accelerate intestinal transit, causing medication to pass through the digestive system too quickly, reducing the time available for proper absorption. In other patients, especially those with severe constipation problems, papaya may actually help regulate intestinal transit, potentially improving medication absorption throughout the day. This variability in response makes papaya a particularly complex fruit to evaluate for elderly people with Parkinson's. Beyond the effect on motility, papain can potentially break down or alter certain medications before they are properly absorbed, particularly protein or peptide formulations. Although conventional levodopa isn't directly degraded by papain, other complementary medications used in Parkinson's treatment may be affected. How does papaya consumption specifically affect speech and mobility in elderly people with Parkinson's? When medication absorption is affected by papaya consumption, elderly people with Parkinson's may experience what we call an erratic response to medication. In speech, this manifests as unpredictable periods of more pronounced dysarthria, difficulty articulating words, alternating with periods of relatively normal speech. This inconsistency in vocal performance can be particularly frustrating during social interactions, where the ability to communicate clearly already presents a significant challenge for elderly people with Parkinson's. In mobility, inconsistent medication absorption can result in sudden episodes of akinesia, inability to initiate voluntary movements, or increased rigidity at times of day when the patient would normally be well controlled with medication. For the elderly, these unpredictable episodes represent not only frustration, but real risks of falls and domestic accidents. What is the safest guidance for elderly people with Parkinson's regarding papaya consumption? The ideal answer depends significantly on the individual characteristics of each elderly patient. For those who primarily suffer from severe constipation, ripe papaya, not green, can be beneficial when consumed as part of breakfast, away from medication times. On the other hand, for patients with a tendency toward accelerated intestinal transit or those who notice symptomatic fluctuations after consuming papaya, the recommendation is to completely avoid this fruit, especially green or semi-ripe papaya that contains higher levels of papain. For most elderly people with Parkinson's, a prudent approach would be completely avoid green papaya. Consume only small portions of very ripe papaya when papain concentration is lower. Never consume papaya with medication or in the hour before taking it, and carefully observe any pattern of worsening symptoms after consumption to decide if this fruit should be completely eliminated from the individual diet. It's important to note that papain supplements or teas made with papaya leaves contain much higher concentrations of the enzyme and should be completely avoided by elderly people with Parkinson's, regardless of their individual situation. Our sixth, potentially problematic fruit for elderly people with Parkinson's is pineapple. Known for its refreshing flavor and anti-inflammatory properties, pineapple is generally considered a healthy choice for the elderly population. However, for those with Parkinson's, especially in advanced age, this tropical fruit presents important considerations that should be taken into account to optimize treatment and quality of life. The main mechanism by which pineapple can interfere with Parkinson's treatment is related to bromelain, a potent proteolytic enzyme present in high concentrations in this fruit, especially in the central stem. Bromelain, similar to papaya's papain, has properties that can significantly affect the absorption and effectiveness of Parkinson's medications. First, bromelain can alter the pH and permeability of the gastrointestinal tract. For the elderly, who already naturally present age-related changes in intestinal absorption, this additional effect can result in inconsistent or reduced absorption of levodopa and other medications. Particularly concerning is the fact that bromelain can potentially degrade certain protein medications before they are completely absorbed. Additionally, pineapple is a highly acidic fruit, with pH typically between 3.3 and 4.0. This high acidity can interfere with the dissolution and absorption of controlled-release formulations frequently prescribed for elderly people with Parkinson's, such as extended-release levodopa, carbidopa. When the coating of these medications is prematurely dissolved due to extreme acidity, the active ingredient may be released too early in the digestive tract, resulting in peaks and valleys in blood levels of the medication, instead of the planned gradual and constant release. How does pineapple specifically affect speech and mobility in elderly people with Parkinson's? When medication is absorbed inconsistently or prematurely degraded, elderly people with Parkinson's frequently experience what we call accelerated wearing off phenomenon, where the medication effect ends much sooner than expected. In speech, this manifests as periods of relatively clear and strong communication, followed abruptly by episodes of weak, monotonous, or slurred voice. This sudden deterioration in communicative ability can occur in the middle of conversations or important social interactions, causing frustration and potentially social isolation. In mobility, accelerated wearing off manifests as periods of reasonable mobility followed by sudden freezing while walking, intensified tremors, or difficulty performing fine motor tasks that the patient could execute just an hour before. For the elderly, these unpredictable fluctuations represent not only a reduction in quality of life, but real risks of falls and accidents. What is the safest guidance for elderly people with Parkinson's regarding pineapple consumption? Considering the potential risks associated with bromelain and pineapple acidity, the safest recommendation for elderly people with Parkinson's, especially those in more advanced stages of the disease or who use extended-release formulations, is to completely avoid consuming fresh pineapple and its juice. For those in early stages of the disease who wish to keep pineapple in their diet due to its nutritional benefits, some strategies can reduce risks. Opt for cooked or grilled pineapple, as heat partially denatures bromelain. Consume only the flesh, completely avoiding the central stem where bromelain concentration is highest. Never consume pineapple on an empty stomach or with medication, always as part of a balanced meal. And limit consumption to small occasional portions, never daily. It's important to note that bromelain supplements, which contain the enzyme in much higher concentrations than fresh fruit, are absolutely contraindicated for elderly people with Parkinson's due to the high risk of drug interactions. Our seventh and final potentially dangerous fruit for elderly people with Parkinson's is mango. Although nutritious and tasty, rich in vitamins A, C, and fiber, mangoes present specific characteristics that can significantly compromise the effectiveness of medication treatment in elderly people with Parkinson's. The main problem with mangoes is related to their high content of natural compounds called biogenic amines, especially tyramine. This substance is present at particularly high levels in very ripe or overripe mangoes. For most people, tyramine is easily metabolized by the body without problems. However, for elderly people with Parkinson's who use MAO-B inhibitors such as selegiline or rasagiline, tyramine can cause dangerous reactions. This is because these medications block precisely the enzyme responsible for breaking down tyramine in the body. When an elderly person with Parkinson's who uses MAO-B inhibitors consumes ripe mango or other tyramine-rich foods, what we call a tyramine hypertensive crisis can occur. Symptoms include sudden and dangerous elevation of blood pressure, severe headaches, neck stiffness, excessive sweating, palpitations, and, in extreme cases, risk of stroke. For the elderly, who often already present underlying cardiovascular conditions, this risk is particularly alarming. Besides tyramine content, mangoes contain natural sugars in high concentration, especially when very ripe. These sugars can cause significant spikes in blood glucose, potentially exacerbating tremors and other Parkinson's motor symptoms, particularly in elderly people with sensitivity to glycemic fluctuation or those with concomitant diabetes, not an uncommon condition in the elderly population. How does mango specifically affect speech and mobility in elderly people with Parkinson's? The impact occurs mainly through two mechanisms. First, if a tyramine reaction occurs due to interaction with MAO-B inhibitors, the sudden elevation in blood pressure can cause dizziness, intense headache, and mental confusion, indirectly affecting both the ability to clearly articulate words and the stability needed for safe mobility. Second, the glycemic spikes caused by the high sugar content of ripe mangoes can temporarily exacerbate tremor and motor instability, affecting the precision of movements needed for clear speech and stable gait. Some elderly people with Parkinson's report that after consuming ripe mango, especially in significant quantity, they experience periods of more intense tremor in hands, face, and jaw, directly impacting their ability to communicate and eat independently. What is the safest guidance for elderly people with Parkinson's regarding mango consumption? For elderly people with Parkinson's who use MAO-B inhibitors as part of their treatment, the safest recommendation is to completely avoid consuming very ripe mangoes. If the desire to consume this fruit is strong, the following precautions are essential. Opt only for slightly ripe mangoes, never overripe ones, where tyramine content is significantly higher. Limit consumption to small portions, no more than 1/4 of a mango at a time. Never consume mango on an empty stomach, always as part of a balanced meal to minimize glycemic impact, and carefully observe any symptoms such as headache, dizziness, or palpitations after consumption, which may indicate a tyramine reaction. For elderly people with Parkinson's who don't use MAO-B inhibitors, mango consumption presents less risk of serious drug interactions, but moderation is still recommended due to the potential impact of glycemic spikes on motor symptoms. An interesting alternative for those who appreciate the tropical taste of mango but need to avoid it, is to opt for small amounts of cooked pineapple or very ripe papaya, which offer similar sensory profiles with lower risk of problematic interactions.